All right, hi guys. So I did my research on the psychosocial impacts of health deterioration and aging. So first things first, as OTs, we should definitely be taking a holistic approach when treating our clients, as the inability to perform like meaningful activities such as bathing, dressing, toileting, and navigating one's environment can definitely take a huge toll on one's emotional health. So the correlation between psychosocial well-being and health seems to grow stronger as individuals advance in age. However, aging in itself is not what causes an increased risk for developing depression or any other mental health disorders. Research has found that it's really more the functional status or the loss of independence that some older individuals undergo that really heighten one's risk for developing depression. And one of the greatest risks, however, for developing depression is possessing multiple chronic disorders, as does our friend Nathan. So the risk for any type of mental health adversity is pretty strong in both cardiac and respiratory issues. They both seem to have a strong mind-body connection. So for cardiac issues, specifically for heart failure, the risk for depression in individuals with heart failure is 20% greater than in the general population. Also, if Nathan does exhibit any symptoms of depression, such as like apathy, lack of interest or pleasure in things he normally likes, he does have an increased risk of developing further heart complications, such as a recurrent stroke, for example. Another study did research on something called vital exhaustion, which the researchers defined as a combination of both fatigue and depression. And they said that those individuals who did have vital exhaustion were at a 2 or 3-fold increased risk of developing heart failure. And those individuals with heart failure and vital exhaustion were more likely to have a poor prognosis in their disease or be rehospitalized in the future. And then in terms of his respiratory issues and his COPD, patients who do have COPD often complain of increased isolation, decreased independence, and a lack of engagement in meaningful occupations. So it's pretty unsurprising that the prevalence of psychiatric comorbidities such as anxiety and depression are 30 to 58% times more likely to be diagnosed in patients who have COPD. And you can just imagine what a negative effect not being able to breathe has on your mental health when you're trying to perform the most simple activities such as dressing yourself or even going to the bathroom. So individuals such as Nathan, who does have these chronic comorbid diseases, they often lack coping skills and could benefit from OT intervention, as we do play a role in teaching our patients coping skills. So first things first, the OT should definitely assess Nathan comprehensively, not just physically, but also his emotions. The OT can maybe administer something like the Beck Depression Inventory to see how his emotions are doing. He should conduct a thorough interview with Nathan and definitely ask Nathan about what his social supports are like, what his relationship with his wife is like, and what his coping skills are like as well. And definitely the OT should pay attention to any signs of distress, such as a flat affect, low energy, lack of interest in therapy, or just seeming very restless. So now, in terms of interventions for Nathan, when it comes to his psychosocial functioning, I think that the OT should really focus on promoting independence as well as chronic disease management. So the OT can start off by educating Nathan on energy conservation strategies, as well as lifestyle modifications. So, for example, the therapist can teach the importance of breaking up ADL tasks. So, for example, when he's getting dressed, teaching him how to break up the task of getting dressed and taking breaks in between, just to kind of recharge his energy, and also perhaps enforcing healthy diet patterns. That would be the lifestyle modification portion of that. The therapist should also educate Nathan on breathing techniques, such as we learned about the pursed lip breathing, which is breathing in 2 seconds and breathing out 4 seconds. Exhalation during exertion, so exhaling when he's bending or he's lifting up, as well as the proper positioning to help him when he's out of breath. And then in terms of the physical component, the OT should definitely, incorporate range of motion exercises and low intensity physical exercises at first that don't break his cardiac precautions. And this would basically go hand in hand with other interventions in terms of, building up his strength, building up his endurance so that he starts feeling that he can be more independent with his ADLs. And then last but not least, the OT should definitely incorporate some stress management strategies with Nathan, such as progressive muscle relaxation, guided imagery, mindful meditation, or even prayer, since that's something that Nathan likes to do, and kind of helping him find time in his daily schedule to incorporate those activities. And if the OT deems that Nathan is in a really not so great situation, they can definitely refer him to a psychologist or perhaps even a psychiatrist for further help. Okay, so for my little interactive portion, we are going to do a little bit of mindfulness meditation slash teaching Nathan how to do proper breathing techniques. So I have my relaxing music on, and we could do this if Nathan, for example, is dressing and is having a really hard time, like I said before, and he needs to take a minute break in between two small tasks. So instead of just sitting there and talking for a minute, you could definitely incorporate mindfulness or guided imagery or something around that nature. So I'm going to ask everyone watching this to breathe in through your nostrils for 2 seconds, hold, and breathe out for 4 with your lips pursed like this. And as you breathe, make sure to focus on the air flowing in and out through your nostrils and paying attention to how that feels. So again, in, hold, and out. In, and out. Next, you can incorporate some guided imagery or some positive affirmations. So you could say things like, your body is healing and you are whole and healthy and happy. You are going to be okay. Everything in life is going to be just fine. And also focusing on your breathing. So breathing in, hold, and out. All right, and you could do that for about a minute or two and then move on to the next task.